This conference will now be recorded.
Good morning, everybody. Good morning, my dear students. Today, topic is normal flora, normal microbial flora of the human body. The flora, microbial flora means the microorganisms which are present on the and in the body, present on the body and also inside the body. There are so many bacteria, microorganisms, not only bacteria, viruses, fungi are present in the body, on the body, and maintain some interaction with the human system, so that there will be a maintenance of the immune system and various substances which are produced by the microorganisms, so that our body will be stable with these bacterial microorganisms. Why they are called normal, even though they may cause sometimes disease in the host. Sometimes they are called as opportunistic pathogens. Most of the times they are normal in the human body. What are they? What is the definition? How many types of normal flora which are present inside and outside the body? The human beings, like other animals, harbors a wide array of microorganisms. Wide array of microorganisms. Not only what is one microorganism? Bacteria, virus, fungi, etc. Both inside the body and also on the surface of the body. They are classified into two types. They're broadly divided into two types. The normal flora are divided into two types. What are they? They are resident flora. Second one is a transient flora. Resident means they're constantly present, even with some elimination with some chemical or washing with soap on the surface. They won't decrease in number. We won't decrease in number. They are called as resident flora. They constantly present on the surface and also inside the body. They are called as resident. They are resident flora. Transient flora also, there means they are present sometime, at some point of time they are present. Okay, they are called as in the short period of time, at some point of time they are present. They are called as transient flora, transient normal flora. The first one is resident normal flora and transient normal flora. Suppose if you see the resident normal flora, they are present on the surface of the hands. Suppose if you wash the hands, what happens? The most number of bacteria will be removed because of washing with soap, etc. But after some time they will come. They will come. They are called as, suppose they are present constantly, they are called as resident flora. Suppose with washing they go, they are called as transient flora. The constant flora, they won't remove. We can't remove the flora from the surface or inside the body. The constant flora we can't remove. Suppose on the surface, suppose we take on the surface of the skin, even with the washing also, at the time of washing they will remove, they will go off, but after some time they will come back. They are called as constant flora or resident flora. They are called as constant flora or resident flora. The second flora is a transient flora. At some point of time they are present. Some point of time they are present, but not constant. They are not resident. They are called as transient flora. So the normal flora are divided into resident flora and transient flora. Resident flora is a constant population, constant bacteria, constant fungi, etc. That cannot be completely removed permanently. We can't remove permanently, even with using some chemicals, some washing. They can't remove permanently. They prevent permanent colonization of the body by other microorganisms. They are important for our body. The resident flora are important for our body. They maintain our immune system. What is the usefulness of this resident flora? The usefulness is they prevent permanent colonization of the pathogenic flora. The permanent colonization of the pathogens causing bacteria. That is the importance of the resident flora. Without resident flora, we can't survive. Without constant flora or resident flora, the human body can't survive. They're present in the body. They maintain the homeostasis of the body. They maintain the immunity of the body. They maintain the some vitamins, etc. They etc. in the body, and also they secrete some antibacterial substances which are act against the pathogenic bacteria. They are called as resident flora. They are called as resident flora. The second one is transient flora. What are transient flora? They may be potentially pathogenic. They may be potential. They can produce disease. They can cause disease. Pathogenesis are non-pathogenic organisms present at some point of time, but not always. They may be pathogen, but they may not pathogen. They may be pathogen. They may not pathogen, but they are present in between at some point of time, but not always. But not always. At some point of time, they are present. They are called as a transient flora. They may be pathogenic. They may not be pathogenic. But the most important is that the resident flora are important for our body. Resident flora are important for our body. We cannot be completely removed permanently. They are important for our body. They prevent the colonization of the pathogens. The resident flora prevents the colonization of the multiplication of the pathogenic bacteria. That is why the resident flora are important for our body. That is why they are called normal flora. They are called as normal. Without this normal flora, we can't survive. That is why the bacteria are ubiquitous. The bacteria are ubiquitous. They are present in the human body. They harbor the human body, and they survive in the human body. They cause the help to the human body. Sometimes they also produce disease in case of transient flora. Transient flora may be potentially pathogenic also. Sometimes whenever there is opportunity, some bacteria, there is some immune mechanism fail, they may be converted into pathogens also. Next, the role of normal flora in the what is the importance of normal flora? The normal flora become pathogenic when host defenses falter. Whenever the host defense is damaged, whenever the host defense, immune system, innate immunity, acquired immunity is defective, falter, these bacteria will become pathogenic. They are called as opportunistic pathogens. They are called as opportunity. Whenever the opportunity coming, this normal flora will become pathogenic. The normal flora will become pathogenic. Whenever there is a host, the immune system defense mechanism, post-immune defense mechanism fail, fault, then will be these non-pathogenic will become pathogenic. They are called as opportunistic pathogens. They are called as opportunistic pathogens. They prevent invasion of the body by pathogens. They prevent invasion of the body by pathogens. The importance of the normal flora is the invasion of the body by pathogens. That is why the normal flora is very, very important for our body. Without this normal flora, our body cannot survive. Our immune system will break, and also the pathogen become non-pathogenic, and so that the patient will get infected and disease will come to the host. That is why the normal flora are important. They prevent the multiplication of the pathogens. They prevent invasion of the pathogens. They prevent invasion of the pathogens. They prevent multiplication of the pathogenic bacteria or pathogenic microorganisms. They raise the overall immune status of the host against the pathogens having related or shared antigens. They raise the immune status. Because of this normal flora, they secrete, the normal flora will secrete some antigens. These antigens will stimulate the immune system, and so that the antibodies and anti-infective immunity will produce. This anti-infective immunity is important for the immune status of the host. The anti-infective immunity is important for the immune status of the host. That is why these normal flora, antigens of the normal flora, the toxins of the normal flora will stimulate the immune system, so that our immune system will be activated. Immune system will be activated, so that no disease will occur because of this normal flora. These are the barriers for the infections. Normal flora are the barriers for the infections. They prevent the multiplication. They prevent the colonization of the pathogenic bacteria. They prevent the colonization. They prevent the multiplication of the pathogenic bacteria. So they raise the normal flora raise the overall immune status of the host by getting the immunity from the immune response, getting the immune system, immune status from the immune response of the pathogenic normal flora bacteria. So that is why it raises the immune status. It raises the overall immune status of the host. Next, it causes a confusion in the laboratory diagnosis due to their resemblance to some pathogens. That is one problem. It causes confusion in the laboratory diagnosis. Okay, that is the one problem in the confusion of the diagnosis of the normal flora. The normal flora synthesize vitamin K in the large intestine. Vitamin K is important. It prevents the blood clotting. Blood clotting. That is why the vitamin K is important for the human body. It is why these bacteria, normal flora bacteria, will produce vitamin K. Not only that, these bacteria will produce B complex vitamins. B1, B2 vitamins are stimulated by the normal bacteria. That is why the normal bacteria are important. Normal flora are important for the immune system, or human body, or human host. And then the normal flora produces antibiotic substances. The antibiotic substances are produced by the normal flora. They are called as colicins. There are some substances, antibacterial substances are produced by the bacteria. Antibacterial substances are produced by the bacteria. These are called as colicins. These colicins will cause the inhibition or prevention of the infections produced by the pathogenic bacteria. Prevention of the pathogenic bacteria. So the colicins are produced by the normal flora. The colicins are antibiotic-like substances. The colicins are antibiotic-like substances. They fight against the pathogenic substances. They fight against the pathogenic bacteria. These are the uses of normal flora present in our body, or resident flora of the bacteria of the human host, resident flora of the human host. And it liberates endotoxins. It liberates, the normal flora will liberate endotoxins. Normal flora liberates endotoxins, some lipopolysaccharide substances. These lipopolysaccharide substances which are produced by the normal flora. So all of you know that these substances which stimulates the pathogenesis. But this is important for our human body because of these endotoxins which are produced by the normal flora. It can programs the triggers the alternate pathway, complement pathway. It stimulates the alternate pathway. It is the minor amount of alternate pathway is stimulated. This is also important for the human body, protection of the human body, the immunity of the human body. These bacteria liberates endotoxins. These endotoxins, the minor amount of liberated endotoxins are produced by the normal flora. These minor amount of liberated endotoxins will programs, will activates the alternate complement pathway, so that our immune system will be monitored, programmed to fight against the any uneventful mechanisms produced in our body. That is why these are the usefulness of normal flora. The first one is when host defenses fail, they become opportunistic pathogens. They prevent invasion of the body by pathogens, and it raises the overall immune status of the host against pathogens because of related or shared antigens. And this normal flora synthesize vitamin K and vitamin B complex vitamins, and also sometimes cause confusion in the diagnosis due to their resemblance to some pathogens, and this normal flora produces antibiotic substances which fight against the pathogens. Bacteria produce antibiotic-like substances called as colicins, which fight against the pathogens. And sometimes these bacteria, normal flora, liberates endotoxins, which stimulates the complement pathway, innate immunity. It triggers the alternate complement pathway, These are the uses of normal flora. Okay, these are the uses of the normal flora. There is some cooperation between the interaction. There is an interaction between the human host and the microorganisms present in the nature. There is always interaction in the nature and the host. Nature and the host. Nature means bacteria, bacterial nature, and the human host. Because of this interaction, which there will be a sometimes disease, sometimes immunity. Sometimes disease, sometimes immunity. The normal flora is important. They won't cause any disease. The normal flora won't cause any disease. They won't cause any disease. Normal flora. They are normally present in inside the body and also on surface of the body. They cause there are various uses of the against the normal flora. There are various uses of the normal flora. Coming to the conjunctiva, normal flora, conjunctival normal flora. What are they? The conjunctiva of the eye is free from microorganisms. Conjunctiva of the human conjunctiva is free from microorganisms due to always a flushing action of the tears. Flushing action. Because of tears, our whatever bacteria present in the normal flora and normal conjunctiva will be removed. So that the flushing action is important for the eye. Flushing action of the tears. Because of this organelles present in the tearing organs present in the eye, they will because of tears, whatever the bacteria present in our eye will be removed, eliminated from the eye. What are the organisms present in the eye? The conjunctiva. Diphtherides, also called as Corynebacterium gyrosis. Corynebacterium gyrosis is present in the conjunctiva. And not only that, diphtherides, moraxella also present. Diphtherides, moraxella, staphylococci, and a non-hemolytic streptococci. Moraxella, staphylococci, and a non-hemolytic streptococci. These are the bacteria present in the eye, conjunctiva. Because of the flushing action, many pathogenic organisms are present, they will be eliminated. Even then, these organisms are present in the eye. These organisms are present. It is a normal flora of the eye. They cause some usefulness to the eye. They are present always. Some staphylococci are present, some non-hemolytic streptococci are present, some diphtherides are present, some moraxella are present. These are the normal flora of the conjunctiva. These are the normal flora of the conjunctiva. The conjunctiva contains normal flora. They are useful to the eye. Some pathogenic organism sometimes comes and cause infection to the eye. But because as long as the normal flora are present, as long as the normal flora is present, usually there is no infection to the conjunctiva and eye. Conjunctiva and eye. Usually, because of flushing action of the tears, the pathogenic organisms will be removed. Flushing action of the tears, the pathogenic organisms will be removed. Next, the most important, normal flora of the skin. The skin contains various number of bacteria, various types of bacteria, various species of the bacteria. What are they? Always they are present. There are various types of bacteria. The diphtherides are present on the skin, including propionibacteria. Diphtherides are present. Diphtherides are skin contaminant, skin normal flora. Diphtherides, diphtheria-like bacteria. Diphtherides are diphtheria-like bacteria in the morphology, but they are not pathogenic. The diphtherides are not pathogenic. They are diphtheria-like morphology. Diphtheria, Corynebacterium diphtheria-like morphology. That is why they are called as diphtherides. They are present on the skin. Next, staphylococci. Staphylococci, aerobic and anaerobic. Aerobic staphylococci and anaerobic staphylococci are present. Staphylococci are present on the skin. of the human body, human host. Streptococcus viridans on the present on the skin. Sometimes these bacteria may be present on the various organelles, various organs. They may cause pathogen, but as long as on the present on the skin, they are not pathogen. As long as on the skin, they are present on the skin. These bacteria like Staphylococci, Streptococcus viridans, Streptococcus faecalis, they are not pathogens. They are not pathogens. They are present on the skin. Usually, they are present without causing any disease. Without causing any disease, they are present on the skin. What are they? Diphtherides, Staphylococci aerobic and anaerobic, Streptococcus viridans, Streptococcus faecalis. They are present on the skin without causing any disease. Without causing any disease, they are present. They are normal. That is why they are called as normal flora. They are called as normal flora of the skin. Next, gram-positive spore bearing bacilli. The gram-positive spore bearing bacilli, they are present. Gram-negative bacilli, Escherichia coli. The Escherichia coli present on the skin is normal. Suppose Escherichia coli present in the very other organisms, urinary tract, it is pathogenic. Escherichia coli present in the skin, it is a normal. Same bacteria present in the genitourinary system, it is pathogen. That is why I am talking about only normal flora of the skin. Normal flora of the skin only, not of the other organisms, other organs. But here the Escherichia coli present on the skin is normal. So similarly, the protease present on the skin is normal. And other intestinal organs present on the skin is normal. Other intestinal organs present, any organism, intestinal organism present on the skin, they won't cause any disease to the skin, even though they are present on the skin. Even though they are present on the skin, they won't cause any disease to the skin. They are normal to the skin. They are normal to the skin, but they may cause disease to the other organs. They may cause disease to the other organs. That is why the heading is normal flora of the skin. Next, non-pathogenic mycobacteria. The mycobacteria present on the skin. The mycobacteria present on the skin they are non-pathogenic. Next, Candida albicans. The Candida albicans present, suppose it present on the skin, is non-pathogenic. The same Candida present in the oral cavity, in the genitourinary system, in the vagina, it may be pathogenic. Candida vaginalis, Candida albicans present in the vagina, it is pathogenic. Candida albicans, suppose it is present in the vagina, it is pathogenic. Suppose the same Candida albicans present on the skin is not pathogenic. It is a normal flora. It is a normal flora to the skin. Candida albicans present on the skin is normal. Candida albicans present on the skin is normal. Same Candida albicans present in the vagina may be pathogenic. Candida albicans present in the vagina is pathogenic. That is why the normal flora of the skin is Candida albicans. Similarly, Cryptococci. These are the various normal flora of the skin. Diphtherides usually present on the skin without causing disease. Staphylococci present on the skin without causing disease. Streptococcus present on the skin without causing disease. Streptococcus faecalis present on the skin without causing any disease. And E. coli, Escherichia coli present on the skin without causing any disease. Protease and other intestinal organisms present on the skin without causing any disease. Okay, Candida albicans present on the skin without causing any disease. These are the various normal flora of the skin. And similarly, the Pitrosporum bovale, skin fungi, Pitrosporum bovale present on the skin without causing any infection, skin infection. Next, Staphylococci, the penicillin-resistant Staphylococci, seen in persons working in hospital. This is a normal flora. Staphylococci, penicillin-resistant Staphylococci, seen in persons, doctors, nurses, having skin harbors the bacteria. Penicillin-resistant Staphylococci. Penicillin-resistant Staphylococci present on the skin. Penicillin-resistant Staphylococci present on the skin without causing any disease. Next, hair frequently harbors Staphylococcus aureus. It is a reservoir for cross infections. Reservoir for cross infections. Reservoir for cross infections. Staphylococcus aureus present on the hair frequently harbors it It is a reservoir for cross infection, infection to the other organs. This is a skin hair organism causing infection to the other organs, not hair, some other organs like Staphylococcus upper respiratory tract infection to the others, Staphylococcus aureus infection to the urinary tract, and other organs are infected by the normal flora of the hair bacteria like Staphylococcus aureus. So their organisms present. These organisms are present only on the skin without causing any infection to the skin and hair. Any infection to the skin and hair, but it may these organisms may cause infection to the other organs. May cause infection to the other organs. But these organisms are called normal organisms of the skin. These organisms are called normal organisms of the skin. But these are same organisms may give infection to the other organs of the host. Next, normal flora of the nose. Normal flora of the nose, nasopharynx, and sinuses. The flora of the nose harbors Corynebacteria. Flora of the nose, Staphylococci and Streptococci. Corynebacterium, diphtheria, and diphtherides, Staphylococci, and Streptococci. These are the normal flora of the nose. Normal flora of the nose. Usually it is present in the flora of the nose. And similarly, the Haemophilus species and Moraxella lacunata, Haemophilus species and Moraxella lacunata is also present in the nasal cavity. Next, nasopharynx. Nasopharynx of the infant is sterile at birth. Sterile. Usually, the nasopharynx is sterile at birth. 2 to 3 days after birth, it acquires a common normal flora and pathogenic flora of the mother and the attendants, nurses, etc. Usually, it is sterile at birth. 2 to 3 days of the birth, the nasopharynx of the infant will get the organisms from the mother and the nurse and the attendants. Mother, nurse, and the attendants. These are called as commensal flora and the pathogenic flora of the nurse, mother, and attendants. Because of the closeness of the mother, because of the attendants, etc., the organisms, whatever present in the close relatives, mother and nurse and attendants, bacteria will come to the infant nasopharynx. Usually, they will come after 2 to 3 days. They settle in the infant nasopharynx. They continuously present throughout the life of the individual. These normal flora, these are called as normal flora of the nasopharynx. The pathogenic flora in the nasopharynx may be the source of infection of the upper respiratory tract. The pathogenic flora of the nasopharynx may be the source of infection. These are the normal flora of the nose and nasopharynx and sinuses. Next, normal flora of the mouth and upper respiratory tract. First, mouth. What are the normal bacteria present in the mouth of any individual? Normally, the pigmented and non-pigmented micrococci are present. These micrococci are nothing but the clusters of round organisms. The micrococci, similarly like Staphylococci, the micrococci. These are the usually normal flora. The micrococci they won't cause any disease. The micrococci won't cause any disease. They are present inside the oral cavity. They are present inside the oral mouth. In the mouth, they won't produce any disease. These are the micrococci. They won't produce any disease. They are pigmented and non-pigmented micrococci. Not only that, the gram-positive ASBs are present. Like a Clostridium bacillus species. Gram-positive ASB, aerobic spore-bearing bacillus species are present in the mouth. Similarly, the coliform bacteria also present. The coliform proteus, lactobacilli. The lactobacilli is a normal flora of the mouth. Lactobacilli is a normal flora of the mouth. The proteus, sometimes intestinal flora, like proteus flora, is a normal flora of the mouth. Proteus and some other coliforms also present inside the mouth. So The mouth also contains normal flora. Mouth also contains normal flora. Everywhere inside the body there is a normal flora. Everywhere inside the body also normal flora is there. Without causing, normal flora means no disease is usually produced. They are useful to the human body. They are useful to the human body. Suppose there is any immune system breaks, these normal flora will produce disease. Suppose any invasion, the breaching in the defense mechanism, this normal flora may converts into abnormal flora, pathogenic flora. And next, coming to the gum pockets, the gums contains anaerobic flora, candida is present in the gums, normal, geotrichum present in the gums. Infant mouth not sterile at birth, not sterile. It contains mother's vaginal flora. Why? Because the mother flora will comes to the baby during delivery, during birth passes. To the birth passes, whatever the mother vagina contains bacteria, this vaginal flora will comes to the baby, and but replaced in 2 to 5 days by the flora of the mother's mouth. So the vaginal flora which is going to come to the baby during delivery. After few days, 2 to 5 days, this vaginal flora will be eliminated. The mouth vaginal flora will be replaced by the mother's mouth flora comes to the baby. Mother's mouth flora comes to the baby. This is the normal flora only. After birth, not only the normal flora, the alpha hemolytic receptor are present respiratory tract after 12 hours of the birth, which dominates and remain for life. This is the normal flora of the individual from birth to the after birth to the remaining life. See the normal flora of the mouth and upper respiratory tract, the density of the bacteria, normal flora, and frequency of the occurrence in the population. The density, esophagus and stomach, the lactobacilli are present. Lactobacilli is a normal flora. Lactobacilli is a normal flora is present in the esophagus and stomach. Small bowel, duodenum, jejunum, and ileum. Along with the lactobacilli, streptococci also present. And coming to the jejunum and ileum, enterobacteria species, bacteroides species are present. Next, large bowel, there are so many bacteria present. What are they? Anaerobic cocci and aerobic bacteria. Anaerobic and aerobic both are present in the large bowel. It is a fecal matter. The large bowel means the fecal matter. The fecal matter contains various anaerobic, gram-positive anaerobic, gram-negative anaerobic bacteria. Gram-positive, gram-negative anaerobic, and also aerobic also present. See, what are the anaerobic bacteria present? They are anaerobic non-spore forming anaerobic bacteria, Bacteroides, Fusobacterium, Enterobacter, the other Lactobacillus, Clostridium, which are anaerobic bacteria. Anaerobic bacteria are present, and also Bifidobacterium, Eubacterium, and Bacteroides species. These are anaerobic Eubacteria, Bifidobacterium. These are anaerobic bacteria. These are anaerobic non-spore forming bacteria. The normal aerobic bacteria like coliforms are present. And Enterobacter fecalis. Is present. And Salmonella are sometimes present, pathogen. And Pseudomonas aerobic bacteria. It is aerobic. Pseudomonas is aerobic bacteria. Streptococci is a facultative anaerobic. Facultative anaerobic is also present. Klebsiella is also present. Escherichia coli is also present. These are aerobic bacteria. Both aerobic bacteria present, anaerobic bacteria also present. Both aerobic and anaerobic bacteria are present. The yellow color is the frequency is less than 10%, and the brown color is 100%. The brown color is 100%. Light pink color is 25 to 75%, and the black color, that is a gray color, it is a 10 to 20%. The gray color 10 to 25% of the frequency of the aerobic bacteria and anaerobic bacteria. Both aerobic bacteria and anaerobic bacteria are present in the large bowel in the fecal matter. It is present. It is a longitudinal distribution, frequency of occurrence and densities of the bacteria making up the normal flora of the fecal matter, normal flora of the fecal matter of the large intestine. Normal flora of the gastrointestinal tract. See, what are they? I'm telling. 80 to 90% of the newborn infants, the meconium is sterile. At birth, meconium is sterile. Within 4 to 24 hours of the birth, intestinal flora is established. Intestinal flora is established. In breastfed infants, lactobacillus bifidus accounts for 99% of the total organisms in feces. 99% of the total organisms in the feces. Enterococci is present, and Enterobacteriaceae, E. coli, Klebsiella, colon bacilli are present, and Staphylococci is also present in the gastrointestinal large intestine. And bottle-fed infants, Lactobacillus acidophilus, colon bacilli, Enterococci, gram-positive aerobic and anaerobic bacilli, and these are the bacteria present in the bottle-fed infants. Bottle-fed infants. The diet has marked influence on the composition of the intestinal and fecal flora. So these are the various bacteria, aerobic and anaerobic bacteria present in the gastrointestinal tract. Gastrointestinal tract. Because of the low pH, the stomach is sterile. Proliferation of the gram-positive cocci and bacilli occurs in the carcinoma, achlorohydria, and pyloric obstruction. Because of the low pH, the stomach is sterile. Proliferation of gram-positive cocci occurs. Usually, the stomach is sterile because of low pH. Because of these diseases like carcinoma, absence of acids, and pyloric obstruction, the flora is changes. The flora is changes with gram-positive cocci and bacilli. Gram-positive cocci and bacilli. Number of bacteria progressively increases from duodenum to colon. In adult duodenum, 10 to the power of 3 to 10 to the power of 6 bacteria per gram. That is the duodenum bacilli. In the jejunum and the proximal ileum, 10 to the power of 5, 10 to the power of 8 bacteria per gram. In the normal bacterial flora. These are the normal bacterial flora. In the jejunum and the proximal ileum. In the duodenum, adult duodenum, 10 to the power of 3 to 10 to the power of 6 bacteria per gram of the secretions. 10 to the power of 3 to 10 to the power of 6 bacteria per gram of secretions. In the gram of secretions of the duodenum, 10 to the power of 10 to the power of 3 to 10 to the power of 6 bacteria are present. In the jejunum and ileum, proximal ileum, 10 to the power of 5 to 10 to the power of 8 bacteria per gram of secretions of the jejunum and the proximal ileum. In the lower ileum and cecum, 10 to the power of 8 to 10 to the power of bacteria are present in the secretions. In the colon, fecal mass, and rectum, 10 to the power of 11 bacteria are present. In the fecal mass, 10 to the power of 11 bacteria per gram of feces. Per gram of feces, there is a 10 to the power of 11 bacteria per gram of feces. That is the load of the bacteria. That is the work. That is the bacterial load present in the colon of the bacteria. 10 to the power of 20% of fecal mass. And duodenum and upper ileum, lactobacilli and enterococci are present. Lower ileum and cecum, same as fecal flora. Same as fecal flora. Adult normal colon and anaerobics and aerobic are present. Usually, the anaerobic flora are main. Anaerobic flora, particularly in the normal colon, the anaerobic bacteria, gram positive, gram negative, anaerobic bacteria are present. Bacteroides and bifidobacterium and other lactobacilli and various bacteria present. They are anaerobic bacteria of anaerobic bacteria which are present, not spore forming, which are present in the colon, which are present in the normal flora. For 1 gram of feces, 10 to the power of 11 anaerobic flora are present. Particularly, the most of the major bacteria are anaerobic only. Only aerobes like E. coli and Proteus, etc., only 1 to 4%. Cocci, etc., which are only 1 to 4%. But mainly, the anaerobic gram positive, gram negative bacteria are present. Mainly, which are 10 to the power of 10%, 10 to the power of 10 feces bacteria per gram of feces. 10 to the power of 10 bacteria per gram of feces. They are anaerobic bacteria only. Most of the bacteria, anaerobic bacteria, they are anaerobic gram positive and gram negative. Anaerobic non-spore forming. They are anaerobic non-spore forming bacteria. What is the spore forming? Clostridium, etc. But here, the fecal matter, colon secretions contains anaerobic bacteria. anaerobic bacteria. And some coming to the normal flora of the genitourinary tract. Genitourinary tract, normal flora of the genital. The Mycobacterium sphygmatis is a harmless bacteria found in the sphygma of the genitalia of both men and women, may be present in voided urine, causing confusion in the laboratory diagnosis. And then not only Mycobacterium sphygmatis, in the normal men, Lactobacilli, Gardnerella vaginalis, alpha hemolytic streptococci are present. Lactobacillus, Gardnerella vaginalis, and alpha hemolytic streptococci are present in the genitourinary tract normally. Genitourinary tract normally. Along with that, the bacteroid species, Chlamydia trachomatis and Ureaplasma ureatic are present in the normal in the genitourinary tract. Chlamydia trachomatis and Ureaplasma urealyticum is present in the normal flora in the genitourinary tract. In the female urethra, coming to the female urethra, the female urethra is sterile. The vulva of the newborn child is sterile. After 24 hours, acquires non-pathogenic organisms of the skin, vagina, and intestine. And normal flora of the vagina is newborn also sterile. After first 24 hours, it acquires varied flora of the non-pathogens like micrococci, enterococci, and diphtherides. Micrococci, enterococci, and diphtherides. Normal vaginal flora. 2 to 3 days of baby, maternal estrogen induces glycogen deposition in the vaginal epithelium, facilitates the growth of lactobacillus. This bacillus is also called doterlin bacillus, which produces acid from glycogen. The lactobacillus is predominant. 2 to 3 days after that birth, lactobacillus will come. After decrease of estrogen, glycogen disappears along with the doterlin bacilli. pH of vagina becomes alkaline. Micrococci, alpha, and non-hemolytic streptococci, coliforms, and diphtherides will come to the vagina of the baby. And adult puberty. What is the normal flora of the puberty? Glycogen reappears, and due to activity of the doterlin bacilli, the pH becomes acidic and prevents colonization by harmful microorganisms. At puberty, the doterlin bacilli will come. Doterlin bacilli. In pregnancy, it increases in the Staphylococcus epidermidis, doterlin bacilli, and yeast. In pregnancy also, the lactobacilli will present, particularly in the pregnancy. The Staphylococcus epidermidis is also present along with the lactobacillus or doterlin bacilli, along with the candida, etc. After menopause, the vaginal flora same as before puberty. Normal vaginal flora contains, in the particular in the vagina, in the menopause, anaerobic cocci, bacilli, listeria, anaerobic streptococci, mycoplasma, Gardnerella vaginalis, Neisseria, and spirochetes. These are the bacteria which are present after menopause. And suppose coming to the bacteria present in the blood and tissue, usually the bacteria present normally won't present in the blood and tissues. Usually, whenever it is any bacteria comes to the blood and tissues, they are removed by the blood substances, blood antibacterial substances present in the blood. The normal flora of the mouth, nasopharynx, and intestinal tract may get into the blood and tissues usually. They are quickly eliminated by the normal defense mechanisms of the body. So, the whatever bacteria, sometimes minor 1 or 2 bacteria will enter into the normal circulation, they are eliminated by the normal defense mechanisms of the body. The organ should be isolated more than once to consider significant. Usually, any bacteria won't present in the blood and tissues. They are eliminated by the normal defense mechanisms from the blood and tissues of the human host. Next. This is about the normal flora of the bacteria, normal flora of the human body, inside the body and also outside the surface of the body. Next, pseudomembranous colitis. What is pseudomembranous colitis? It is a disease causing by the various conditions. How it disease produces in the human host. Pseudomembranous colitis. Because of indiscriminate use of antibacterial agents. Indiscriminate use of antibacterial agents eliminates resident flora. Permitting exogenous and endogenous pathogens to gain entry and cause disease. Indiscriminate use of bacteria eliminates resident flora, permitting exogenous and endogenous bacteria to gain entry and cause disease. When oral broad spectrum antibiotics are given, diarrhea occurs as a side effect due to overgrowth of the yeast or staphylococci. broad spectrum antibiotics are using continuously, the diarrhea side effect due to the overgrowth of candida, etc., and sometimes staphylococcus, etc., they will produce pseudomembranous colitis. And not only that, antibiotics, particularly like clindamycin. The clindamycin, suppose if you use, there will be overgrowth of anaerobic gram-positive bacilli. There is a bacterial accumulation. That bacteria is called Clostridium difficile. Clostridium difficile is accumulated and cause pseudomembranous colitis. Clostridium difficile is produced and pseudomembranous colitis is produced. This is called the accumulation of Clostridium difficile. Therefore, the narrow spectrum of antibiotics at correct dosage for a correct duration of time will be effective and will not suppress gut flora, thereby preventing the growth of the Clostridium difficile, which is a dangerous bacteria, particularly in the immune compromised states. Immune compromised states are over killing of the normal flora, particularly in the over killing of the normal flora, the Clostridium difficile will come into the picture and cause pseudomembranous colitis. Pseudomembranous colitis. This is about the importance of the normal flora. Importance of the normal flora to the human host. What are the normal flora? What are the various normal flora present on the various organs of the human host? What is the importance? What is the disadvantage when the normal flora will destroy by the some agents or and some immunocompromised conditions, some antibiotics, etc. This is the uh, normal flora of the host. Thank you. Any doubts?
cancel